Hello ladies and gentlemen, and welcome to this video podcast from Vetstoria. My name is Morko Pinar, and today I'm going to discuss the topic of strangles in horses. Strangles is one of the most commonly encountered respiratory diseases affecting equines. To illustrate this topic, I'm going to present a case recently seen by one of my equine colleagues. The patient is a yearling and was bought a week before. The new owner called the vet because a horse was not eating and had a nasal discharge. The vet quickly found that this yearling had the typical symptoms of strangles. He had general symptoms of infection such as a high temperature, anorexia and weakness. Additional, more specific symptoms were a yellow nasal discharge, swelling below the jaw, and swelling of the lymph nodes around the throat. Strangles is caused by a bacterium called Streptococcus equi. As the disease progresses, the abscesses spread to the retropharyngeal and submandibular lymph nodes, which become harder, painful, and swollen. The local inflammation and the swelling caused by the pus production in the lymph nodes can cause difficulty with breathing and swallowing. This condition is very painful, and this explains why this yearling was constantly keeping his head down and his neck extended to reduce the pain in his throat and the lymph node area. When lymph node abscesses mature, they may rupture into the nasal passages or through the skin. The diagnosis is relatively straightforward in this case because of the classical clinical signs. It can be confirmed by taking a swab from a draining abscess or from the nasopharynx. As described before, this disease is very contagious and can spread very quickly in a stable through direct contact between horses. This can be either from a horse which is already showing the classical signs or an asymptomatic horse which is incubating the disease. It can also spread via indirect contact, such as on hands, equipment, and through clothing. Signs of the infection appear 3 to 14 days following the first contact with the bacteria. Symptoms can vary depending on the age of the animal. Young horses, under 5 years of age, are more sensitive than older horses, and foals, under 4 months of age, are usually resistant because of the immunity acquired through the colostrum of the dam. Some horses can develop abscesses and lymph nodes of other organs, such as the lungs or in the abdomen. These abscesses can grow and rupture internally and may cause death. This condition is called bastard strangles. Minor complications, such as laryngeal paralysis, inflammation of the heart muscle, anemia, and emphysema of the guttural pouches can also occur. A small number of horses are chronic carriers and become a major source of infection for other horses. They carry the bacteria within their guttural pouches in the form of dried pus. Finding these carriers is very important to reduce the impact of the disease in a yard. This can be done by endoscopic examination and washing of the guttural pouches and taking several nasopharyngeal swabs for analysis. To treat the horse, it is sometimes necessary to open the abscess. The vet is performing a needle puncture of the retropharyngeal lymph node to assess the contents inside the lymph node. Here, you can see the pus being aspirated into a syringe. The vet performed a small incision in the skin over the lower part of the lymph node. This allows the cavity to be flushed until there is no further discharge. The healing process can take several weeks. Painkillers and antibiotics are also given after the surgical procedure. Antibiotics are not always prescribed because they cannot easily penetrate the abscess capsule and may actually slow down the maturation of the abscess. it is possible to reduce the impact of the disease by prevention. If a new horse is introduced into a stable, he must be kept in quarantine, if possible, for at least 2 weeks. Every horse that develops a nasal discharge must be isolated and swabbed immediately. Overcrowding should be prevented at all costs. The sharing of tack and equipment from horses of unknown health status should also be avoided. A vaccine is now available in the UK. This vaccine doesn't guarantee total protection, but the clinical symptoms would at least be less severe. Well, I hope you now understand what Strangles is and how severe the impact of this disease on your stables could be. That concludes today's video podcast. Thank you for listening. And remember to check out vetstoria.com for further video podcasts. And feel free to leave any comments or suggestions for future topics. Goodbye.